Hello everyone, here is another video where you will find everything you need to know about Mrcog Part 3 examination. Now what does this examination test? It tests your knowledge, skills, attitude and competencies. It is an essential waypoint for UK trainees to pass from core training to higher training. Before I go into the details about the examination, let me tell you about the changes. Thanks to the pandemic, the assessment has changed from face-to-face to remote assessment in all countries except the United Kingdom. Now, what has changed? UK had fully remote assessment last May, but will have the same old face-to-face pattern this November. For the rest of the countries, it is going to be a fully remote assessment. And what's not changed? The content, format, structure, statistical analysis, standard setting, and results calculation. Moving on, the doctors are eligible to appear for Part 3 examination after they've passed Part 2 examination, have held for not less than 4 years a medical qualification that is recognized by the General Medical Council, and have had their assessment of training approved. Now, many candidates have the doubt that how much time is there between Part 2 and Part 3? How soon should I appear for Part 3 after passing Part 2? Well, there is no time limit between Part 2 and Part 3, but the college does require you to attempt at least once in 7 years after passing Part 2. A total of 4 attempts are permitted, and if you do fail to pass, you would have to give Part 2 examination again. The format of the examination hasn't changed. 14 tasks in a circuit, each task based on one of the 14 modules mentioned in the syllabus. Each of the Part 3 modules is assessed in the context of 5 domains: patient safety, communication with patients and their relatives, communication with colleagues, information gathering, and applied clinical knowledge. Now, all these domains will be mentioned in the question that will be pasted on the wall or in the question which will be presented via OSLER platform. Each task is 12 minutes in length. It includes 2 minutes of your reading time. Now, there are 2 types of examiners: a trained clinical examiner, which obviously will be present on all the 14 tasks, and a trained lay examiner, who will feature in 4 out of 14 tasks, assessing the domains of communication, patient safety, and information gathering. There are 2 types of tasks. The first one, simulated patient or colleague task, which involves a candidate interacting with a role player. There can be 1 or 2 examiners at the station. For example, patient complaining about abnormal uterine bleeding or a junior colleague asking for help with neonatal resuscitation. The second type of task is structured discussion, which involves candidate interacting with a clinical examiner. Here is a tip. Be patient and attentive in task with lay examiner. There will be 4 people in the room: candidate, patient, clinical examiner, and lay examiner. It is the maximum scorer. Try and do really well in these stations. You do not look or communicate with the examiners. How does face-to-face examination look like? You start at one station, say cubicle 3. When the buzzer rings, you get 2 minutes to read the question pasted on the wall. Another buzzer goes off and you go in. After 10 minutes, buzzer goes off again and you leave the room to move on to reading the next question at station 4. Buzzer rings, you go in. Same continues at 5, 6, 7 till you go to station 2, which would be your last stop. A total of 168 minutes. Phew, it's exhausting, tiring, and the fastest examination of your life. Here is a video on the remote assessment via OSLER platform. First, you log in with the details provided to you. Then, check the camera, microphone, connection, and quality. Make sure you're well positioned. And then check the volume. After this, you will join a waiting room. You will be joined by a member of college who would do the verification process. Then your reading time. There will be buttons to zoom in, zoom out. You can scroll down to see the investigation results as well. There will be a place at the bottom where you can write down anything that you think would be important in your examination. There will be a countdown before every station, before every reading time. And that's how your stations start. This would go on for 14 stations. After the stations finish, just wait for the exam session to be verified. And then you log out. The Vimeo link of this video is in the description below. Syllabus and how to prepare. Read the Mrcog syllabus curriculum published in 2019. Be thorough with all the guidelines and books you used for Part 2. It is really important to know how NHS works. Talk to the doctors who work at NHS. For instance, letters are an essential mode of communication between GP and consultant obstetrician. A pregnant woman is first booked with a midwife, who then decides whether that woman needs to see a doctor or not, depending on the woman's history and antenatal period. Talk to the doctors who've passed to get a detailed idea about what is being asked and plan your study. Who knew that one day social media can help us learn too? Join groups at WhatsApp, Facebook, and Telegram to get free study material, recalls, and information about courses. Be a part of important discussion and clear your doubts. Find a study partner. Studying together really helps boost your confidence too. After all, it's a clinical exam. Revision courses. The one run by Mrcog is awesome. Difficult but awesome. It is not just a mock test but includes group discussions, questioning, and reasoning. The same goes for ACE courses. There are some amazing doctors who provide these courses online. This was me, and I believe many non-UK candidates, while reading the words ST3, ST4, GP surgery, appraisal, summative formative OSAT, incident report, MDT, reflective feedback, clinical governance, and so on. One solution: find a doctor who works at the NHS. He or she would be able to reduce your confusion. Thank you for watching the video. If you did find this video helpful, please do like, share with your friends and colleagues, and subscribe to my channel. All the best for your preparation and your examination.